friend, and we are honored to have her. Her name is Noel Klug-Konkel. Thank you.
Hi everybody. Thank you very much for coming out tonight in remembrance of Rose and all others who have lost their battle with ovarian cancer, including my 18-year-old cousin, second cousin, last year. In celebration of all the survivors and in support of the Wisconsin Ovarian Cancer Alliance. I apologize, but while I am sharing my own personal story, I have not practiced enough to share the format in which I want to share with you, so I may be reading from my notes quite a bit. My name is Noel, as Steve said, and I'm a coworker and a friend of Tracy. I remember when Rose passed away a few years ago, and watching Tracy and how that affected her absolutely broke all of our hearts. And seeing her spring into action and bring awareness to this awful disease was so heartwarming. She has worked so hard over the years, gathering donations, marketing, advertising, and making it the event that we're all enjoying tonight. I didn't have the pleasure of knowing Rose. I didn't know very much about ovarian cancer. And fortunately, at that time, I didn't know anybody that suffered from the disease. Regardless, I always made a point to come because I know how much it meant to Tracy, and I knew it was for a good cause. Last year was the first year that I was not able to attend. Last year was the first year that I wasn't able to attend because I had just recovered from my own surgery, the diagnosis of ovarian cancer. It was a very scary shock. I had to stop with my choice. I know, I'm sorry. I'll go hide. I'll go sit It was a very scary shock to me and my family. My family and me, sorry. My name is Noel again. I'm 33 years old. And I'm standing in front of you tonight as an ovarian cancer survivor. If you see me up here sweating, it's not nerves, it's menopause. It's loads of fun, just wait till you get there. Or it could be a combination of both. I was lucky enough to not have to endure any sort of chemotherapy. They were pretty sure when I had my surgery that they removed all the cancerous cells. I continued to go to my oncologist regularly for blood draws and just physical checkups. I have a higher risk of the cancer coming back within the first 2 years, kind of going a 5-year hiatus, and then it's likely to come back 7 years and beyond. I will discuss more about what led to my surgery shortly, but after it was performed, my mom, who's over here, she did so much work for me. She did major research and scheduled appointments with numerous oncologists. I had my surgery at St. Mary's, Milwaukee. We went to another oncologist at St. Mary's. We went to Fredert, and then she even scheduled me an appointment at Mayo Clinic in Minnesota. And we had a little ladies' trip and enjoyed our time out there. So if and when I do have to go for another surgery, it will be at Mayo Clinic. All 4 sources said the same thing. I was so lucky to have caught it early. Early detection is absolutely key. I urge all you women out here to make sure to go to your OBGYN. Family practitioner is better than nothing, but your OBGYN is more likely to discover it sooner as they see it a little more often. They can usually feel it even long before you can. On that note, that's probably why I was diagnosed late. I was overdue for my yearly exam, only by a couple of months, but I wasn't too worried about it because I was very young. Well, not very young, but I was young enough. And I was healthy. I was very athletic. I didn't smoke. I drank, not regularly. I drank enough. And it may have been caught sooner if I had gone in earlier. And I'm going to tell you a little bit about what led up to my surgery, so bear with me, it's a long story. I am already so blessed and so thankful to have an 11-year-old son named Joey. My husband and I decided in 2011 that we were going to have a second child, which would have been his first biological child. There were many times that I thought we were successful, and I was absolutely heartbroken and so confused when the pregnancy test would come up negative. I was nauseous, exhausted, constipated, and I had some major abdominal cramping, which all of those were sure signs of pregnancy. I did not have those symptoms at my normal monthly cycle, and I thought for sure I was pregnant. And every time a negative result came, I just said, oh well, we'll chalk it up and calculate ovulation a little bit better and try again next month. And also I wasn't in any major rush to get pregnant because I was still young at some time, and I was a little worried about how I could handle being pregnant and running. I'm an avid distance runner. One of my passions in life has become running. Throughout the year I've been training for various races, and I was preparing for the Door County Half Marathon coming up that May. Among all the other athletic aches and pains that runners experience, I started having sharp pains in my right side, and it was near my hip, and it was going on for a couple of months. My husband, caring about me as much as he does, was nagging me to go to the doctor, and I just kept pushing him off, saying it's silly to go to the doctor for pain when I know it's from running. I know that I'm overtraining, I'm doing it to myself. I'm not going to go to the doctor for pain in my hip. But eventually it got to the point where it was starting to bother me, so I went to WebMD, which most people do when you want to self-diagnose yourself with whatever is going on. And I put in my symptoms, and I was like, it's bursitis. I have bursitis, so I treated myself for bursitis. I did foam rolling, I massaged it, iced it, and it was feeling better for a little while. But I figured I'd just run through it and it would eventually improve. We went out one night for like a 3-mile run, just a quick, easy 3-mile run, no problem for me at that time. And I got to about the mile marker and I just started crying. I couldn't even handle it. The pain was so severe. So finally I decided to listen to my husband and went in and got it checked out. I saw my nurse practitioner, Sandy. She's absolutely amazing, and she knows Jeff. They used to work together. Jeff is my husband. They used to work together years ago, so I know that I can go to her and talk to her about anything, and she'll take me seriously, and she'll understand. So she did a thorough check of my hips, my back, my lower back, my leg, everything. She even felt around, and she said, you know, I think you're right. I think you have bursitis. So I was like, yes, I knew it. I knew I had bursitis. I was so proud of myself. I went home and texted Jeff and I said, I was right. So she said, no, Jeff, let's do an x-ray just to see, make sure it's not any structural, bone structure issues that could cause long-term damage. And so I said, all right, I guess if it'll make my husband happy, we'll do it. So we did that, and she called me a couple days later. I think we did the x-ray on March 29th of 2012. She called me a couple days later and said, it looks like you have a stress fracture. And I was just beside myself. I knew that my running days were over. If I got a stress fracture just from running, then I wasn't meant to run. I broke my hip running, and I was devastated. So she said, let's get an ultrasound to get a better result, or get a better look at it and see if that's indeed what it is. So I started calling around immediately, trying to. This one was MRI, sorry. This one was MRI, and I started calling around to see who could get me in sooner because I needed to know. I was in the middle of training. I needed to know now what it was. And so she tried to get me in at St. Mary's in Milwaukee. Nobody could get me in. I finally got in at an orthopedic hospital. My husband had some connections, I think, there, and got in, and they did the MRI, and she said, everything looks pretty good. It's definitely not a stress fracture, so right away I was, it was fine. I knew I could run again. And she said, but we're going to send the results to your doctor, and we'll get back to you on, within a couple of days. So my nurse practitioner called and said, it looks like you have some sort of fibroid or mass on your right ovary, so we need you to get in for an ultrasound. And she wasn't too concerned. I wasn't too concerned because I have friends with fibroids, and it's not a big deal. They even have children. They've dealt with this. It's not a big deal. yay, I can run. So that's all I was thinking about. I was not worried about it at all. She scheduled the ultrasound for the next day, so I met my husband at work, and he drove me there, and we went for the ultrasound, and he was watching. It's not a very comfortable position to be in for a female, so I didn't watch. I was just trying to restrain myself. And he said that they kept focusing on one area, and they were measuring it over and over, and but they didn't say anything, and they said within 3 days you should hear back. So I was mentally preparing myself for the longest 3 days of my life, because I'm an instant gratification type of girl, and I want to know now. And once we were done, I was able to pack up and leave, and she said, no concerns, your doctor will get back to you. So I dropped Jeff back off at work, and I went home to get ready for work myself. And then after I got out of the shower, I was getting dressed for work, and my phone rang, and it was Sandy, my nurse practitioner, and I knew something was wrong. And she had said, Noel, we think you have ovarian cancer. We need to get you in with an oncologist. And she did. She scheduled an appointment for me for the next day, and I didn't know what to do. My life flashed before my eyes. I was terrified. I was sad. I was scared. And I was worried most about my son, because what would he do if I were to die? And I didn't know what to do. So I called my husband, and he didn't answer. And I called my mom, and she didn't answer. I called my best friend, and she didn't answer. I just sat there. What am I going to do? So eventually I called my boss, who is also my mother's boss, and I said, I can't come in. This is what's going on. I have ovarian cancer. Well, I know I said that, but I'm sure all she heard was, cancer, mom. So she got my mom, and my mom got on the phone, and in typical mother fashion, she dropped everything and came to my house, making a few phone calls on the way. And before I knew it, my sister-in-law, Jenny, was there. My mom was there. My dad was there. My husband was there. My brother was on the phone. And we talked, and we discussed options, and cried, and we went for a nice long walk. And the whole time, I just felt so outside of myself. I didn't feel like Noel. And it was a feeling I'll never forget. Just having my family there really, really, truly helped. I don't know what I would do if it weren't for that. And then she scheduled the appointment for the oncologist, so we went to see the oncologist on Thursday, April 5th, and he was great. He answered our questions, he listened to our concerns, and we have diagrams in the office, and it was just an overall good time, and a hopeful time, because he had said that I'm pretty sure it's benign. We're going to shell out that tumor, reconstruct your ovary, we're going to leave you with your fertility, because he knew we were trying to have a child. And he just said that if, worst case scenario, if the pathology results come back showing cancer, then we'll have to do a complete hysterectomy. It's like, that's worst case scenario, I don't think we're going to have to deal with it. So I left there feeling so hopeful and knowing that, okay, we're going to get through this surgery, everything's going to be fine. And as my mom said, if it comes down to it, we'll put the boxing gloves on and we're going to fight it. So he scheduled the surgery for April 9th, 2012. So we need to get this out. So we went in and we got it out. And during surgery, though, he had to go and get my husband because the pathology results came back showing that I had cancer. And my husband had to make the decision on the spot on whether he was going to have his own biological child or not, because he had to make the decision on whether to have a complete hysterectomy or just try to remove the cancerous cells and hope. And my husband, as always, put me first and knew that he wanted a fighting chance of a life together with me. And we already had Joey, and so Joey's fantastic, and he said, remove it all. And the fact that it was in my lymph nodes is the reason why it was staged as it was. It was stage 3C ovarian cancer. There's another term for it, something serous tumor. And again, I didn't need chemotherapy, which is great, because the type of cancer that I have does not respond well to chemotherapy, and at my age it would do more harm than good. And we got that same result from all 4 doctors that we went to, so I know that, if it does come back, we are going to catch it early, and I know I'm going to be okay. All the doctors were very shocked at how my story unfolded. What a miracle that an x-ray picked up something that looked like a stress fracture, which prompted the MRI and the ultrasound, which eventually led to locating this tumor. I'm so thankful for my husband's constant begging to go to the doctor, and my nurse practitioner's concern and competence, and that running one of my passions in life helped to find the tumor. Being in shape actually really helped me through recovery, because I was back to running 4 weeks after surgery. I remember when I went from not being able to walk down the street after a couple days to being able to go around the block, and then eventually back to running. I would say within 2 months I was back to running 16 miles, so that was very nice. I'm currently training for the Lakefront Marathon in October, so you guys can all come and cheer me on. There's so much more I can say about how this has changed my life and changed the lives of my friends and family and coworkers, but I'm sure that